discretion. If you want to delay it a week and do it then, that's fine. You can do it today. You can make changes to it. It's totally within.
Where are we at time-wise with the deadlines, you know?
There are no deadlines. I think that there's no deadlines that would be compromised by waiving.
The ultimate deadline is October 2nd.
Other than maybe having to draft some of the documents would be the only thing, because if they're set up with today's date.
Sure, what's the pleasure of the board?
Yeah, I have no problem tabling this for discussion in the next meeting.
Okay.
And by the way, these changes, I believe, are all up on the internet.
They can be today.
Or can be today, so that would make sense.
Regina was going to do it this morning. I'm not sure if she's had a chance to do that yet or not.
How close are we to finalizing the capital improvement plan?
In terms of time, I would say within the,
Not to put you on the spot,
Yeah.
Nathan.
right. I'd like to have it in September.
Okay.
Probably optimistic, but I'd like to have something in September.
One other question we're going to talk about a little later on is the state of emergency. Is any of that in effect how we move forward with the state of emergency, or the OES and the sheriff with all the stuff that's going on?
There will be, we think, an opportunity to recover some funding through Title III, because the fire up in Little Valley area is on Forest Service. So I think we'll be able to recover some expenses through the Title III, and there may be other sources as well. I don't think it'll have as far as we know now, I don't think it'll have a negative impact on the budget.
Yeah, if anything, at some point in the future, depending on how long the fires go, what impacts we see, there is some opportunity for a reimbursement from the federal government, and we may be able to use we could use Title III money to cover some of our costs. If anything, we may come to you at a later date if we exhaust or dip too deep into overtime in some of our lines. We may come back in some future date asking for an additional appropriation and outlining what revenues we received to help cover those costs. That's the only impact I can see right now.
But it would, I think these would likely be offset by increases in revenues if we
Yes.
need an increase of appropriation.
So is it the pleasure of the majority of the board then? It just, I know that any of the department heads have anything to say?
Jennifer's not going to say anything, but I did want to point out that on her behalf, the probation budgets were a significant topic of debate at the budget committee meetings and at the board, and thanks to a lot of creativity by Jennifer and her staff, they made a significant contribution to the overall budget. I appreciate that.
She's going to get a proclamation.
She gets the Creative Budgeter of the Year award or something like that.
No, that's for sure.
We all owe Jennifer a shout out, I think.
What's the bottom line general fund support for probation, since you brought it up?
I knew I was going to regret it. Julie might have it handier than I do. Good luck.
It's in your revenues on page 15. The general fund supports $901,149, and it's on page 15 of the new revenues that I provided today.
Okay, say that again now. I mean, I got that, I'm on that page, and where's the number?
That's
901,149.
yeah, it's about the ninth line down, ninth line.
Yeah. Does that include that 900 1,000, does that include the,
Does that include the juvenile hall, is that what you're asking?
no, there's one of the court-related fine revenues that we receive from the courts.
The court fines are on the bottom, .550, is that where you're looking?
Yeah. What we learned from Karen 2 years ago as a kind of a side type thing, that in addition to the, whatever was the general fund support above, that transfer in that 900 and, what is now 901,000. So
It does not include the court fines that have
it
been.
does not?
No.
Okay, so the court fines, that 550,000, okay, is actually a general fund revenue, but it had been treated since the 90s, and I think this goes back to Bixby when it was a much smaller amount and they needed some money for the juvenile hall support. They sort of kind of allocated it, like said, okay, just like
Dedicated,
Williamson
yeah.
Act is credited to planning, even though Williamson Act has nothing to do with planning, it's a general fund money that would be eligible for any general fund department to use. And so that became kind of like tied to the, tied to probation or to the juvenile hall. And so in reality, instead of being $900,000 of general fund support, because we're allocating that 550,000 additional general fund revenue to backfill or to support the operation of whether it's the juvenile hall or the department itself. So in reality, we're supporting out of the general fund for the probation juvenile hall operation in the neighborhood of $1,450,000. So, which is down from where we were earlier when it was grown up. When you added all that together, we were like around 1.7 whatever. So I mean, we're making progress. But this idea, oh good, we're down under $1 million of general fund support is a misnomer. And I think that just needs to be stated for the record. Not for your benefit, Jennifer, but for Richard. So when we present the numbers, we need to tie those two together because they are linked together by policy action of the last 20 years. We only realized that when Karen made that nexus here a couple of budget years ago. And I appreciated her for doing that.
Thank you, Jim. But what came under the microscope this time last year was the actual juvenile hall portion. And that was where we made big strides there, and where Jennifer's efforts were focused. She kind of came under the microscope, if you will, and she, with her work, she got the big debate was whether is it cheaper to send the kids out or to provide services here.
And also using the project facility for a group on there. I just have to say Jennifer performs very well under the microscope, and I hope she continues as such.
And Jennifer, what is the average daily cost now per child? We talked about the budget. It's in about $382, if I remember.
For the 10 beds, if you have 10 children, it's $297.80. If you base it off of
Based off of current
12, 13 average daily population of 8, it's $372.25, which is cheaper than it was in 2011.
See, I'm not going crazy. I was only off by $9.75. The meeting was like about a month ago. So, but what I'm saying is, my point is, it's very reasonable and highly unlikely we could send kids out for less than $372 a day. So, we're able to serve the community, keep jobs, and that's a very reasonable average daily rate. And it certainly is represents a figure that's less, and in some cases far less than some of the other counties' average daily rate. So, yeah, well done, Jennifer. So, if it's the pleasure of the board, we'll put this on the next week's agenda and try and wrap it up then.
Yeah.
That's fine, if there's one other,
Sir, I think we should, in respect to Ken's request, people wanted us to talk about that. Ken did bring his stuff to Budget Committee. We did discuss it, there was some talk about, revenue. The timing couldn't be worse, so is kind of what the conclusion was. In a budget where there's already going to be a bit of a shortfall that we're certain will balance out, because every year we kind of did some historical data going back over the last 3 years. The amount of the budget is unspent due to positions not being filled. There was definitely a factor that we worked in. So although on paper it may look like $600,000 or $700,000 shortfall, in reality it will more than likely be equal or a little bit of a surplus when we look at the actuals. But it was discussed, and the extra amount of money that would be, we only a fraction of that 1% goes to the county coffers of the added assessments, or Ken talks about funding new airlines and stuff. So it was a huge sum of monies that needed to be on there before they would pay for that position. Not that and like Ken said, it's also a service oriented, but to that regard, I can't speak for the whole county, but I can speak for some of the people I know, more particular the people that bought our place, and within a couple of weeks, I mean, they had been contacted by the assessor. So I don't think it's taken them too long to get hold of people. I've had some properties personally that I've bought that needed changes in assessments, and I received them all in a timely manner. So I don't think we should ignore the request, but I'm of the opinion still, as I was in the last meeting, that it's a horrible time to add another $50,000–$60,000 to budget already.
So how many cents on a dollar do we get on an assessment? Does the county get?
of the
fraction of 1 cent.
$1 tax rate.
Just
We
to
get
simplify it.
20 cents on the dollar, the city gets 7 cents on the dollar, the special districts get roughly 3 cents on the dollar, and the schools get the remaining 70 cents on the dollar. That's kind of roughly the formula. It will vary a percent here or two from year to year, depending on what's going on, but overall, that's kind of a breakdown. So when you pay your property tax bill, we only get 20 cents of every dollar you pay. It comes to the county general operations.
Now you say that the schools get 70%, and that's statewide?
No. Well, no, the schools get funded based on average daily attendance, but
I get that.
But the percentage goes to the schools up until and then the state makes up the difference. So if the tax rate isn't enough to fund the ADA level, then it's subsidized by the state.
Got it.
So
if you had a case where the tax rate was higher than the ADA, then theoretically, I guess the school district would get
the extra money.
Yeah.
Okay.
Yeah,
okay.
Out of the $20 million roughly in property tax collected, about 14 million or so will go to the schools. But the school budgets collectively that are supported by the state through the ADA formula might be 19, might be $25 million. So they're going to get their $25 million. The state just uses our 14 million or so as the first payment of that, and then they make up the difference out of the state education fund. But they capture at 70%, and it will vary from county to county. And in San Francisco County, because Willie Brown was the chair of Ways and Means and he was the speaker, they basically get 80 cents on the dollar that they out of the property tax. So the formulas are totally skewed, and there were 10 counties, and we're one of the 10 counties that basically got the short end of the stick when they divided up the money after Prop 13 passed, the pots. And it was because we were conservative, we had healthy balances that we maintained, kind of like what we do right now, where we have an unallocated unspent portion of the budget. And as time goes on, when they develop their formulas down there, those counties and cities or jurisdictions locally that are prudent get penalized. We get the privilege of paying our money first before they use their money, is the way they operate.
Okay, any more discussion on that? So we'll bring this back next week.
Yeah, I have one item, and it ties to that, and I think it'd be worth exploring. It doesn't have to be done before we adopt the budget, but I think it needs to be looked at. And, you know, it's actually triggered by the memo from the auditor dealing with the request for additional funding for the overlap and bringing in a new assistant auditor and doing all that, paying for that. Is historically, you know, we've got 3 of our elected departments this year in which the assistants are moving up to be the top person in the office, which means there's going to be 3 assistant positions opened up in which the historical practice is whoever the new person is in office gets to choose who the assistant is. But historically, over the last 100 years, the way you get elected to those offices is to be the assistant first. So rather than having a primary in which the people choose who they want, you basically ratify the selection made by the outgoing office holder that was made years before when the assistant was recruited and selected. So since that's the practice that we have, and we recognize that, you know, ultimately the office holders are going to have to choose who they want to be their assistant. But I'd like to see as part of, and this could be part of the condition in terms of us being asked to fund it, just like we do with probation where the judge was making the selection but we had to pay the bill, but we negotiated the deal where now we are going to be basically making the decision, county administration. I'd like to see that the selection of who the new assistant assessor, treasurer, and auditor, those positions, be a wider determination as to selecting who those people are, to make sure they have the job qualifications, the skill sets, you know, the prerequisites, the requirements, and it's not just solely left to those 3 individual elected departments to make in a vacuum on their own, doing their own thing, maybe working with personnel. So I'm not sure how to do that, but it would be nice to see who will be eventually selected in those 3 positions are people, you know, because they're going to ultimately down the road, it could be 1 term, 3 terms, 10 terms, how many, would very likely be the next person filling that office. And so as instead of, I think that became a clear issue in this last election, and I think it would be fair to have that, you know, a policy defining how we do that, broadening that scrutiny and selection, whether it's a citizens panel or, you know, it's other departments, it's county administration, but participate just like we do now where we come up with a set of candidates, we give it to the judge, and the judge picks out of that selection who they'd like to be. So I think that's worth bringing.
Okay, so if there's nothing more, we'll leave this issue and we'll take it up again next week. Thanks everybody for the contributions to the discussion. Okay, we'll move on to D2.
Thank you, Mr. Chairman. John Mino, Undersheriff. We've got just a quick update for the board on the status of the health system at the county jail. As you'll all recall, Dr. Meadows had announced his intention to retire earlier this year. We worked out an emergency stopgap go-forward contract where Meadows is still on as our medical director, and then with 4 separate, 3 physician's assistants, 1 nurse practitioner to come and host daily sick call. The board signed off on that contract that will go through the end of the calendar year. So we have been very busy since then trying to now draft a more permanent solution. We have an RFP out as we speak. It went out on July 18th. Next week we'll be hosting a facilities tour for any of the potential vendors that want to come in. August 19, questions and answers will close, and August 26 proposals are due. But just to keep this in the full forefront of the board's mind, there's again, there's a lot that has to be done, but there are many potential outcomes here that are not very favorable. you know, of what we're faced with, there's really one good conclusion, and that would be that we get responsive bidders, and that when we get those responsive bidders, that there's one that we can ultimately negotiate a formal contract with, ratified by the board, and come up with a long-term solution. That is the best case scenario, but there are some others that we think that it's important the board is up to speed. One would be no responsive bidders. And right now there are 4 primary big private providers that do corrections healthcare. And we sent the RFP to all 4 of those directly, along with, locally, we sent it to Banner Lassen, we sent it to Lassen Indian Health, we sent it to Northeastern Rural. It's up on the county's website, it's advertising in the local paper. But of the big 4 privates that do this, that really this is their bread and butter, 2 of those have already told us that they will not compete. Has to do with, you know, part of it has to do with we're remote, we're not anywhere near some of the other infrastructure these big companies have, and it's hard to support these programs if you don't have good help close. So there's still 2 left of the big ones. We haven't heard back yet from any of the locals, not the hospital or Northeastern or the Indian Health Center. So there is a potential we get no responsive bidders. That's still out there. We won't know until the 26th. If that happens, then what that likely means is that we come back. Now we have to reload this thing, scale it down, try and figure out what can the local market bear. If we meet with some of the primary care providers here, what can they support? What can they do? What are they willing to do? And then we're going to have to rework this whole thing. We may have to come up with a whole new RFP and scale it down and try and get that out. And again, the end of the year will be here before we know it. Another potential option is we get responsive bidders, but it's the number comes in so big that it's untouchable. That there's no reasonable way to fund that in this budget. And if that happens, then we're back to option 2. We have to reload, rework it, scale it down, and hope that we can get some interest in the local market. And then the worst case scenario clearly would be not only do we get no responsive bidders now, but we could retool this, scale it down, and get none again in the local market. The group that's doing it now is, I don't want to speak for them and tell you they're completely overwhelmed, but it is a daunting, big task to deal with jail healthcare. And they, at least their preliminary discussions with us are, come December 31st, we are done. We don't want to talk about extensions. We don't want to talk about doing this any longer. So we don't want to cry wolf here or make you think that we're doing this with a gun to our head, but there's clearly a ton of pressure right now. And frankly, if that comes to pass, the worst of the scenarios being no bids period, then we don't have a great option right now. And I mean that literally could mean we are having to chain gang inmates up to Northeastern. And that is a bad scenario under anyone's definition. So hopefully, again, we still have not quite a month to go, a little over 3 weeks to go. We're hopeful. One of the big 4 privates has told us that their initial plan is they really do want to compete. They really do want to try and earn our business. So that would be we have to be optimistic and hope that can come to fruition. As it stands right now, gentlemen, one thing that is painfully clear since we brought the new PAs on is that what we have been doing just isn't enough. And we realize that's a dicey topic, and we don't want to get into the philosophy of how much money do we spend on inmate health care. In the end, it's a duty. Whether or not it's a burden really is irrelevant. We have a constitutional obligation to provide health care to these people that are in our custody, and it's a challenging time. So what we didn't want to do is come back on August 26th and say, we haven't talked about this for several months, but we're back now, and it's either all good news, all bad news, or maybe it's in between because it's good news, but it's really expensive. But any of those things or any and all of those options are on the table. We thought it was important to get to the board and just give you guys an update, especially as you're talking about the budget here today. Because clearly, depending on how this shakes out, it could have major impacts on our budget, whether it's a big private that is a huge price tag, or whether we end up in a worst case scenario where we're having to talk about logistically how to get inmates coordinated, taking them out of the building every day. Nobody thinks that's a good option. Anytime those inmates leave the secure walls of that jail, then there's more exposure to the public than when they're in that jail. And that doesn't matter if we're taking them to court, taking them for an x-ray, to the dentist, or to the doc. We've had a pretty good scenario there where the docs have come to us for, as long as that jail's been in existence. So that's the quick update. We're happy to, if you have any questions or comments. If not, we expect we'll be very busy starting on the 26th. We hope analyzing some proposals that we would like to get back in front of the board in September.
I have a question, Mr. Chairman.
Sure.
In this particular program there, how much of this is 100% general funded, or is it partially supported by state funding, or is it partially supported by federal funding? What's the breakdown or ratio?
So there's a couple. Now, Mel, some of the rural health funds are what has been our jail physician. The penal code will tell you that any medical expenses that are incurred for, to support these inmates is a general fund expense by definition in 4011 of the penal code. Now, I know that the board has used some of the rural health funds and has helped prop up that jail physician side. But this is a huge impact, gentlemen. I mean, right now, this is $1 million combined. We're at, better than 500 for hospital, which is just the ER trips and ambulances and everything else. And we're at more than 4 for the docs, which is to get the docs in, and that's the pharmacy. So combined right now, this is there's an awful lot of money that goes out. And I couldn't say, Mel, how much? You know how much the rural has been propped?
At a public health realignment, we pay $776,000 in rural health services. That's not all jail and juvenile hall health. That's also animal control, the clerk. There's a couple other little pieces, but the majority of it is health, jail health, and juvenile hall health.
Just a point of clarification, all this includes juvenile hall. All the stopgap agreements, the long-term contracts. So John worked with Jen to make sure we can meet the needs of juvenile hall too, by way of this RFP, hopefully. And then I just wanted to thank John for his work on this. Great deal of work, very complicated, putting that together.
Yeah, my question is answered. It's 100% responsibility of the general fund, even though we have utilized either state or federal funds.
It's state vehicle license fees is what it is.
Those state vehicle license funds were traded for general fund dollars, going back to dealing with some of the school stuff with all the triple flips and back flips and whatever the state has done over the years. In other words, I mean, those vehicle license funds.
Yeah, it's public health realignment.
Yeah, are monies that we received as they moved the shells around and, trading for other general funds. So in essence, they're really, we could use them for a variety of general fund type purposes. It's not just dedicated to this particular stream. We've chosen to do that because that's where maybe our biggest need is, and it's a good nexus. I mean, we're dealing with healthcare for inmates and using healthcare type dollars that are available through that. But I just was curious as to where the primary funding source. It's on our back, and we're using our dollars to fund it.
And we have been too, Jim. Through some of the CCP funds that comes in through realignment on the law enforcement or the community corrections side. Last year, the CCP out of that 138 fund directed about $150,000 to help offset costs specific to the realigned inmates. And that's budgeted again this year. So there's $150 coming out of the CCP money in to help offset these costs as well.
That doesn't nearly take care of it though, does it?
It was about half this year.
Yeah, that's one point I was making about, budgeting. It's like you get hammered out of your control with costs, and you get 50 cents on the dollar reimbursement. You're supposed to, run the account. It's just ridiculous. I mean, it's like
Cobble it together.
Yeah. Thank you. Yeah. All right. Any public comment? Anybody? Oh, I'm sorry, Aaron. You have a question. Sorry about that.
Thank you, Mr. Chairman. I had a question. I know that this is such a great big deal, and I was looking at some of the people that you notified with this RFP, and I just wondered about some other ones here, and that is Reno, Mayors, Simsa, Lash Frontier, up at Alturas, and you have the Mountain Valleys there in Eden, or down there in Beaver, the health clinics. Maybe get ahead of the curve. It might be a benefit with these smaller clinics, it might be a good deal for them, where they only need a doctor half-time up there, but half-time down here, you might be able to work together. I don't know if they'd be interested in doing something like this, but I'd like to see maybe you can explore them now early in the game rather than try to get hold later.
And the sheriff and I have talked about that very thing, Aaron, starting to work now on the potential for a Plan B, especially now that 2 of the big 4 privates have already told us, this is such a specialized field. That's the other challenge. In fact, some of the comments we heard from one of the local providers was, well, we can't do that, and we can't